our panelists here and our participants from around the world. Today is an important day because it is the 33rd of our webinars that we started a long time ago in March, and we have traveled a long way. And today is the day that we will be focusing on reflections and gratitude, part of the Department of Education's international webinar series on COVID in 2020. I started with a few words from Steve Maraboli. Forget yesterday, it has already forgotten you. Don't sweat about tomorrow you haven't even met. Instead, open your eyes and your heart to a truly precious gift, and that is today, right? It has been a challenging year in so many ways, but to finish the year celebrating the final 33rd webinar for the 2020 series is truly a gift. We are here together, right? At this, the 33rd international webinar, we have a panel of international members from all the regions of the world who have, everyone here has participated and contributed to the solidarity and cooperation infused by this series. We will reflect on the journey of the series on COVID-19 from March 2020, covering the 32 webinars that we traversed over this time. So today, all of us invite you to join us as we end the 2020 series on COVID-19 with the reflections and indeed gratitude. We're going to focus on our reflections and, very importantly, gratitude that we're all here. Now, before I start, I want to Professor Amnon Kami, our chair and head and chairholder, is with us, and he has sent me a note and suggested that I read this to you. And this is, Dear Professor Russell D'Souza, I would like to thank you on behalf of the International Chair in Bioethics for initiating and running the webinar program. It is the largest webinar project ever held by our International Chair. Managing the project in such a difficult time proved and showed an extraordinary ability. The large list of respected lecturers you have been able to recruit to the project indicates the important status of the Education Department of the Chair under your leadership. I would like to thank Professor Mary Matthew on behalf of the Chair. Thank you, Mary, for the great help you have given Professor Russell in managing the project. Your professional and pleasant management of the session is highly valued. I would like to thank Colonel Professor Derek D'Souza for the important help in managing the sessions. Many thanks are given to the distinguished lecturers and resource participants who gave the project such a high level of professionalism. The 33 webinars offered a significant contribution to the international forces fighting corona epidemic. The International Chair in Bioethics justified its noble aims. Thank you all. And this is by Professor Amnon Kami, who is with us here. Thank you, Professor Kami. And that's to all of you and our participants today. Now, it's as we usually do, I will ask the co-chair, Professor Mary Matthew, to welcome you, and then I'll quickly introduce our panel from around the world who are going to join us as we reflect and offer gratitude. Over to you, Professor Mary Matthew.
Thank you, Dr. Russell, and thank you to all my panelists. I can only say my panelists because I think I know all of you so well now that, you know, all of you took time off and came in, you know, large numbers to help us get through all these webinars. And I really want to thank all of you. And it was really a pleasure. And I think one thing that kept us all going during this pandemic was these webinar series. And we were connected and we felt that we are not alone. So I thank all of you from the bottom of my heart for coming in, especially in, you know, weird timings. You know, people who were in Canada and in USA had to get up early in the morning and come in. They did it so wholeheartedly, and I appreciate that, and I thank all of you. I thank Dr. Russell. He is the motivating force, and he is what binds us all together. And I thank even Professor Kami, even though he says he doesn't want to speak, but he always is appreciative of all the efforts that we put in this webinar series. And of course to Derek, Professor Derek is my what shall I say, partner in the webinar series, and he's been a real help, and he's been managing everything that you see in the background and done very quietly is because of Dr. Derek. I thank all of you, and welcome to this last webinar for 2020, but it is not, it is only for this year. We will renew again. We will renew back our efforts probably with a different theme, hopefully, once we get over this COVID crisis. And it's really you know, lovely that all of you have come and taken the time to you know, reflect on what we have done for this past 1 year, which has really actually really flown, because we were always, you know, on the go in these webinars. So thank you very much, and really even to our participants who have also joined us and from different parts of the world. And that is the beauty of being part of the UNESCO chair, that we can bring together people from all over the world, you know, with one mind and one purpose. So thank you very much, and I'll hand it over back to Professor Russell.
Thank you, Mary. I'm delighted now to introduce to you our very distinguished panel here. We will have some joining, continue to join us. Professor Ravi Venkadekar, he did ring me a little while ago, the treasurer of the WMA, and David Bobby from the Chicago, from the WMA president. He's also going to join us. But let me start with introducing our very distinguished colleague, panelists here. I start with Professor Gerard Furtwinkel, who was here for the first webinar that we had with Joe. All of us had that first one, and now we are here at the last Sunday of the year. So Gerard Furtwinkel from the Hanover University in Germany, and then we have Baroness Elora Finlay. Where is Baroness? Where is Elora? She was here.
No,
There she. Elora has come so many times. She's been. Elora is part of our program. Yeah. She, of course, is from the House of Lords and has contributed with different hats, as not only as a parliamentarian, but as the head of the UK program, but also as the professor of palliative medicine, and many roles she's taken. And then we have Professor Stacey Gallant, who's also been with us in this She's the head of the unit at with the Holocaust at the Mamadi Center. Is that right? In United States, is that right, Stacy? She's been also an important contributor and part of my team. So we have then Joe Taunton, Professor Joe Taunton from Florida, University of Florida, who was here on that first day when we started. He continues to be with us. Welcome, Joe. And where is Kristen? Kristen Jones is the professor, and she's the head at the Lakehead University in Canada, in Ontario, in Canada, has been part of my team, working with us and attending many of the speaking at. She represents the nursing fraternity and has held a couple of webinars, coming up with the expert guidance rules and so forth. That's an important part. We then will have with us, I think, Shabir. Where is Professor Shabir Aminullah from
Canada.
London, Ontario in Canada. He has also been part of our program, has contributed on many occasions. We have Miriam Wagoro from the University of Nairobi, who is also here with us. Thank you and welcome, Nairobi. I'm sorry, Miriam from Nairobi University. We have Miriam there, and we have Professor Pierre Effar from Cameroon, both from pharmacy and from nursing, who all contributed to the program. Then I shall introduce to you Alvin, Dr. Alvin Chan. Alvin Chan, yes, let's say Alvin is from the Medical Association of Hong Kong Medical Association, the treasurer of the Confederation of Medical Associations of Asia and Oceania, part of the World Medical Association. He represents Hong Kong, China, and has been on many times participating and with this program. And we will introduce to you Professor Vivian Hopwood. Where is Professor Vivian? There she is. Vivian Hopwood, again from Professor of Health Law and part of our program, has been joined the Department of Education. She's from the University of Cardiff in Wales. Has been a number of times on our program contributing here. So who else is now left? Harold, of course, and sorry, let me say, Harold is, of course, as you know, has contributed, has given his a number of presentation, and he is from Harvard Medical School, and has played a very important part. And not only that, we have to give him credit for his cousin who gave a political economist who gave a fantastic another review which all of us took part in. So thank you, Harold, for that contribution. So we will have
Professor Bello. Professor Bello.
Yes, yes. Leon, where is Leon? Leon, yeah. Yes, Leon Cohen Bello, a very dear friend, but he is from Argentine and the Buenos Aires, and he has been contributing, Professor Leon Cohen Bello from Argentine. Welcome here to us. And then we have Dr. Puvishnu Devi, who is the head of from physiotherapy. She has been, they have contributed to a number of webinars and developing guidelines, expert guidelines for physiotherapy on ethical practice, clinical practice. And then is
Professor Ilana.
Yes, where is Professor Ilana Bellmaker? She is here, and Ilana represents the public health. She has chaired and taken part in this program. And anyone else?
Ariel is there. Ariel.
And Ariel is from Buenos Aires, and is the translator for us from Spanish to English and
And
vice versa.
Professor Geeta Lakshmi is also there, Dr.
And
Russell.
Dr. Geeta Lakshmi, where is Professor Geeta Lakshmi? Professor Geeta Lakshmi, yes, a Vice Chancellor, a part of our program, has been also part of this. Thank you, Dr. Geeta Lakshmi. So what we're going
Professor
to do...
Pierre is there. I think he's come on now, Pierre
Yeah,
Effa.
Pierre Effa. Yes,
Yes.
Dr. Pierre, Professor Pierre. He's from the pharmacy. He contribute. There's also Richa. I asked her. She
Richard,
spoke.
yeah. She hasn't
Is she
come.
there?
No,
Has
she
Richa
hasn't
come in?
come. She has to come in.
Okay.
She has to come.
Professor Pierre Effa has from the pharmacy has contributed to that program from there. So with that now, our plan is we're going to have a brief presentation on a summary of the of what has happened over in 2020. And then we'll have an opportunity, Dr. Mary will bring an opportunity for all of you to have your reflections. And then Professor Harold is going to have a very quick, short presentation on a very important aspect, the pandemic of false choices. And we'll then move on to gratitude. And we'll have a program there, which will end with a little game that Colonel Derek has organized. Okay? Yep. Over to you, Gerard.
Yeah. Can you hear me?
Yes.
Do you
Yes, I
see
can hear you.
do you see the slides? Yeah.
Yes.
Yeah. Thank you very much for inviting me and starting with an overview about SARS-CoV-2 and what we have learned in 2020. So over the past 7 to 9 months, COVID-19 has impacted nearly every aspect of our lives. And we didn't even know that much about COVID before. So in 2019, nobody knew the term. So now coronavirus disease is called COVID-19, and it quickly spread in China at the end of last year and became a worldwide pandemic in March 2020. So this is almost 9 months ago. It has caused hundreds of thousands of deaths already, and the causative agent, a virus from the coronavirus family, was promptly isolated, and it's named SARS-CoV-2. When we remember what happened in March, April, and May, then we might remember that the scientific effort was directed to several fronts at once. On one hand, researchers were investigating the best clinical management of infected patients. And on the other hand, they were trying to define the infectious aspects of these patients. In particular, it was, and in some instances, it is still necessary to understand when the SARS-CoV-2 positive subject is capable of infecting others, and in which situation that possibility is even greater. In what biological materials is the virus present and at what levels, and how do these levels change over the course of the disease, and are there related symptoms, and so on and so on. There were so many questions, and we did find out a lot during the last months, but partial answers we could find, for example, in clinical studies. And we had a growing number of those studies that have reported clinical and also virological data. And we did do those studies, or those studies have been done in various parts of the world. Now we face the end of the year 2020, and I think it's a good time now to look back together on these months full of uncertainty, coupled with fear, hope, and for some at least also confidence. Although vaccination campaigns have started in some parts of the world already, we still continue to find safe and creative ways to navigate our new reality, because living with the virus is now a real part of our life, and we can't simply ignore it, even that we know now that we might have vaccines available to protect being infected. And but definitely it's worthwhile to summarize in a 10 to 20, 12 minutes presentation. So what did happen during the last months and how did we handle this? So the presentation of my summary is not intended to go over all the details again and all the little tiny steps in the process to get there where we are now. Rather, it's more about important aspects in dealing with the virus and to show that we are pursuing a moving target, and this target also includes various aspects that needs to be considered. And some of these aspects are also directly linked to ethical and also bioethical values. And this is the field where most of us are active in. Outbreaks of COVID-19 can happen anywhere. At the beginning, when I remember what was going on in March and April, there was a lot of wishful thinking and othering. For example, okay, this is the problem of others. This is not mine or not ours. And we had some kind of also assumptions like Chinese people got it because of where they buy their groceries. The Italian people got it because they greet each other and with kisses on the cheeks, for example. People on cruise ships, they got it because of the buffets, and people in nursing homes got it because they are frail. People in New York got it because the city is much crowded. So we found always explanations why some areas in the world have been affected more than others. But now, today, we know that outbreaks can happen in urban areas, in rural areas, in suburbs, and in any culture around the world. The virus doesn't care who you are, who we are. A virus is a piece of a genetic material, in this case of SARS-CoV-2, it's an RNA, and it's surrounded by a protein capsule. And if you breathe, or if we breathe enough particles of the virus, then we are going to get infected. It's very simple, and anyone can get it. And when we refer to the area we are active in, then this is of a big concern when we talk about public health. How do we care with elderlies? How do we care with carers, with children? And also, how do we care also for vulnerable groups? At the beginning, we did talk also about contaminated surfaces. And now we know that they are no longer the main danger. Early on, public health experts advised people to wash their hands frequently, more often. And we remember all the recommendations singing happy birthday twice. Yeah. Disinfect surfaces and also avoid touching faces or your own face. This was based on studies of how other diseases spread, such as norovirus and viruses that cause, for example, the common cold. It's still a good idea to wash your hands. Don't understand me wrongly. And your hands regularly, and to avoid also handshakes, because we know that this is also one part of the game that we have to play to make it even more safer. But now we know that surfaces are not the main vector of SARS-CoV-2. It is in the air. And in the air means that respiratory spread is the most common way for COVID to be transmitted by. And the virus is spread through the air, and infected person breathes it out, and we or you, we breathe it in. And the closer we come to someone who is infected, whether or not this person shows symptoms, the more likely you are to become infected. And the better the ventilation and airflow around you, the less likely you are to become infected. So close proximity indoors means higher risk. Being socially distanced outdoors lowers the risk. And we all remember the measures that have been taken in most areas of the world. And let me summarize statements like stay at home, keep distance, isolate yourself, follow the quarantine recommendations. And this is definitely something that directly relates also to the liberty of each individual. So it's also part of the business we are in. Let's go to slide number 6. Masks, they work. And when the pandemic began, we remember that experts worried that mask buying could exacerbate shortages of personal protective equipment for healthcare workers. And they also warned that masks might make people complacent about social distancing, and that cloths or paper masks can't stop the smallest aerosolized viral particles. We exactly remember, I'm sure everyone here in the group does remember all these kind of discussions. Now we know that masks can greatly reduce the amount of virus that people expel into the air while speaking or laughing or singing, and that masks protect people who are wearing them. So not perfectly, but enough to reduce the transmission of the disease. So it's most important that we follow this. Symptoms or not symptoms. One more area where we are really not really certain about. So many people are infectious without being sick. Other respiratory diseases make people cough and sneeze, and then it's obvious that they are infected. So we remember the original SARS outbreak some years ago, and it made people so sick so quickly that most of them went to hospital. Temperature checks and telling sick people to stay home can't stop symptomatic diseases from spreading. And in the first months of the pandemic, we might remember that many countries started screening people at their borders to detect these cases. But the biggest challenge from my point of view, stopping SARS-CoV-2, is that many apparently healthy people spread the disease without symptoms or before symptoms start, simply through talking and breathing. When we talk about symptoms, then COVID-19 has many, some typical and some atypical. Most patients with COVID present either fever, cough, or shortness of breath. However, many also have other symptoms, including headache, fatigue, gastrointestinal complaints, rashes, or also others. Some people have symptoms for many months, and those are called the long haulers. And the cause is not completely understood by all of us. Most commonly, these individuals get over their acute infection, but they are left with disabling fatigue, marked exercise intolerance, and often a sense of heart racing with minimal activity. And some researchers think that the virus causes inflammation in the part of the nervous system that controls heart rate, blood pressure, and temperature. What is important to know that patients with such cases seem to be increasing in number and will likely further grow as the pandemic continues. But what we know today is that despite the presence of these long haul symptoms, people like these ones are not infectious. So this is important for us to understand. And also we had a long discussion in spring that maybe in summer everything will be more fine and everything will be somehow under control. But what about summer and winter influence? We know today a warm summer does not stop the virus. Influenza is a seasonal respiratory disease that peaks in the winter. And some experts did hope at the beginning the spread of COVID-19 would also show a similar pattern and slow down during the spring and summertime. Now we know that people's behavior, regardless of season, is the strongest predictor of whether the disease will spread, yes or no. So, protection and treatment. We have made progress on protective measures. We have now 2 vaccines on the market in many of the countries around the world. And we do have also some kind of treatment options. In very short time, our medical researcher colleagues have developed vaccines or identified treatments that work to limit the disease or shorten its duration. For example, remdesivir. even though that we do know now that it might be not that successful as we did expect it at the beginning when it was approved for this indication. But we still do continue having this kind of development so that we get further vaccines and treatments available. We do search on monoclonal antibodies, for example. And vaccinations have started in the UK and right just yesterday also in Germany. Along with the option to vaccinate, ethical questions have arisen as well. And for example, questions who gets vaccinated first had to be addressed in ethical guidelines that refer to limited resources and how we should handle with those. One of my favorite items when I talk about SARS-CoV-2 or COVID-19 is the information. And I want to put it here like that: misinformation kills, because politicians or anti-vaccine activists and members of the right-wing media, to their everlasting shame, they have used the pandemic to stoke racism, spread misinformation, and amplify conspiracy theories. And their followers, they take it for serious, and they have threatened, for example, health officials, refused to wear masks, refused to cooperate with contact tracers, and rejected proven basic public health advice about social distancing. Experts have to share clear, trustworthy, accurate, and actionable information based on the best evidence that we have. Spreading lies does spread the disease for sure. And this is what we have learned as well during the last months. The message style is also important from my perspective, and it should concentrate on united. If we ask for acceptance and compliance, it is our all responsibility to properly communicate to the public what we know, why we do implement measures, and what we do expect from those, that everybody does understand why something is required, and hopefully he will be convinced then, and it might be more easy for him or her to follow those measures. Where we are now, COVID-19 isn't going away anytime soon. The pandemic will end when we have reached herd immunity to the virus. This is what we know, and this was under discussion in many countries from the beginning. We remember the approach that Sweden took when we faced the pandemic at the beginning, or the UK, where we said, okay, we go a different way. Nowadays, in December 2020, we are almost on the same track. The herd immunity, this will happen when either enough people have become infected and develop immunity, or even when enough people are treated with an effective and safe vaccine. And in Germany, for example, where the vaccination campaign did start yesterday, we do have a lot of calculations in the media. So when we will finish to have all the population vaccinated, and we still have a big group in Germany that are not willing to get vaccinated at all. Unfortunately, as a summary from this, we still have got many more months to go, with or without a treatment, with or without a vaccination. So it won't stop that early. And we still have a lot to learn, but the good thing is that we are constantly learning. What we have learned so far, and this is, we learned a lot about the disease, we learned a lot about how we have to behave to somehow get control over it. But what we also learned is that whatever we are facing currently is a result of a globalized world. And we realize that the health of any population, it doesn't matter where this population lives on the globe, is only as safe as it is in its least safe subpopulation. So that means, as a consequence, that if we want to ensure health for all of us, we need to take care of all the vulnerable populations to make sure that also those are properly protected. And it's important to understand that no single country alone is able to manage a proper response to this pandemic. And I was really so happy to see also when we had the vaccine approval process for the Pfizer vaccine or BioNTech vaccine in the European Union, it was decided that it will be an EMEA, a European agency decision. It could have been done much, much faster if we would have went to a national approval level. But this was designed as a European approach for all the 27 countries, or up to today, 28 countries, because the UK is leaving only next week. So for all 28 countries, and it took a little longer. However, now we have this European approach, and with the European Commission, they also have decided a proper and fair distribution of the vaccination vials that will be available or are available now. So it is not that much that one country is just going ahead and say, okay, we do have the money, we do have an agency that is properly working, so we want to go it, and we want to go for it so that our population, our country it can be vaccinated as early as possible. As a conclusion, so we face a pandemic that requires political and also social decisions, and those are of high ethical importance and complexity. I don't have to talk in this round now about the underlying ethical principles, as there are justice, solidarity, beneficence, non-maleficence, and autonomy. We have to keep them in mind, and of course, whatever is going to be decided now, this has to be based on those principles. But they should also be kept in mind when we talk about anything that might come after the pandemic might be solved or might be ended. And whatever we should do, we should also base it, not now only, also later on compassion and international solidarity. And I think whatever we learned so far, we learned that this virus does really bring us somehow together. And one of the forums is, for example, this one. So where we do talk with colleagues from everywhere in the world, and it was always a wonderful experience for me to be part of this team, also for the individual sessions that we had over the year. And I think this is the right way to go forward and to let us be directed by this kind of approach to make sure that no one is left behind, and that the location or any kind of, how should I say, options someone have, that those are not that much important to be properly protected and treated. Thank you very much for having me. Thank you very much for your attention. And I'm looking forward to the final discussion in the second part of today's session.
Thank you, Gerard. It was a very nice summary of what we've seen, what we started, where we went, and where we are today. And so that was good. So that's certainly a start. Now, what we'd like to do is Dr. Mary will take over, and we want to give each of you a chance to reflect. We have in particular from the various colleagues here from different areas, different parts of the world, but also from the different disciplines that came together. We have, besides the medical, we have the public health, we had the nursing, we had the pharmacy, we have the dental, we had the physiotherapy, and so forth. So it's going to be an important role. We want to give this a moment for a little reflection before we have our presentation from Harold. And then, of course, we move to the important area, another important area of gratitude, and what do we understand and how do we go forth, some of the thoughts about the science of gratitude. Okay, over to you, Professor Mary.
Thank you, Dr. Russell, and Professor Gerard, thank you for that beautiful summary. And yes, we have to move forward and looking with hope. Compassion is important, and international collaboration is important, and solidarity is also important. Now, to all our participants who are here, you could also, while we ask each of our panelists for their reflections of this webinar series, you could also put your thoughts in the chat box about what you liked about the webinar series, and did you learn anything new? Was it helpful? And of course, if you'd like to appreciate any of our panelists too, please put it in the chat box. Now, for your information, today's webinar, we have, I'll just read out the countries that are there currently on this webinar. So we have participants from Malaysia, then we have Argentina, we have the Kurdish Republic of Iraq, we have Mexico, we have Israel, India, of course, and Canada, Kenya, Nepal, Australia, USA, Hong Kong, Germany, Cameroon, and Pakistan. Now, over our series of webinars, we did have speakers from Egypt, we had from Saudi Arabia, Indonesia, Sudan, Portugal, South Africa, UAE, Pakistan, and Sri Lanka. So we are talking, this is what we're talking about, the large number of countries that have come in to contribute to this webinar series. And we are really appreciative and thankful from the UNESCO Chair of Bioethics, Haifa. So I will start with the reflections now, and may I request Baroness Finlay? Yes, Dr. Ross.
Mary, sorry, just 1 minute, can I have a word? Can I just, I think he's come late, Professor Sailendra Saraf, who represents the pharmacy.
Yes.
He heads the pharmacy program and is the Vice Chancellor. He's also on the panel, has been part of the program developing the guidelines and so forth through this platform. Welcome to you, Professor Sailendra Saraf. Okay, back to you, Mary, and to
thank you.
Elora.
Baroness Finlay, would you be the opening batsman for the reflections of the webinar for 2020?
Well, thank you so much. And here I am in the UK in the winter, and we have a terrible number of cases rising and death rate rising. I would really like to start by thanking you for the webinar, particularly Professor Russell for his persistent planning of this, bringing it together, and Professor Mary for outstanding chairmanship. Absolutely outstanding, the way that you've managed all of these. And Professor Gerhardt, that was a superb summary and gave us a lot to think about. I'd like to also congratulate all those countries that went for lockdown early and used masks right from the beginning, because they have been proven to be right. I think we've learnt from each other, we've learnt how data collection is incredibly important and it informs the science. We've learned that healthcare professionals are humans and need support, and all other frontline workers need support. And we've become very aware of how devastating poverty is made worse during a pandemic, and the social responsibilities across society, that we will never control disease unless we control the gross inequities in our societies. And I think the other thing that this has shown us clearly, because of the selection of people you've had, is the value of life. That people actually do value lives, they value life even when terribly sick, value life even when profoundly disabled, and we have a duty to each other. And that brings me to that phrase autonomy, because people talk about it as if it's down to the individual. Autonomy is not selfish individualism. And this pandemic has shown us that selfish individualism kills the people who practice it, and it kills other people. And actually, autonomy is relational. It is about having our choices and exercising them in the context of the duty to others. And I think this series has brought that out very, very clearly. And wherever people have been much more considerate across their populations and thought ahead with clear messages, they've done better. And for the population at large, they need very clear, consistent messages from people in authority and from scientists to say what they know and what they don't know. And again, I think in this series, we've learned about different messages, different ways of giving messages to people, and those that work and those that don't. And we have also learned to be humble about the boundaries of our knowledge or lack of knowledge, because our lack of knowledge is huge and we cannot control things. And we have to look at much broader issues linked to climate and economy and so on. So thank you very much for it all.
Thank you, Professor Elora.
Thank you,
You're
Elora.
right. You're totally right. I mean, we have, through this webinar series, we've learned a lot. We've not only learned about the epidemic or the pandemic rather, but also about politics and the social aspects of it and economy and how it's impacted the lives of people. And it was really a humbling and experience and an eye-opener to hear panelists from various countries talk about what is happening actually, the real, what is happening compared to what we know from the media and the news. Thank you very much, Professor Elora. Professor Shabir, I know you're on call. Would you be able to speak now, or?
Sure.
Professor
Can you hear me?
Yeah, Professor Shabir from Canada.
Wonderful. It really has been quite the experience because I think Mary summed it up nicely. We've actually become a good bunch of friends in many ways, and Russell for his incredible energy. I honestly don't know how this man does it. You know, he wakes up at these weird hours, and for me it's very convenient now, but it's midnight for him. With Barris and Finlay, Derek, a truly amazing bunch of people. And I'm so glad that we're ending the year on trying to reflect on what we've achieved, what we haven't, and the summary was outstanding. A few things we do need to remember is gratitude is meaningless if we do not reflect on the pains and suffering of the people on whose lands we live. I live in Canada, and I'm truly grateful for the natives and how accommodating they've been, and we have to remember that. Because if we're not aware of what we have, gratitude is meaningless. I can steal Mary's money and be grateful to God for giving me money. But what misery have I caused Mary? So within the whole notion of bioethics and academics, we have an inherent duty to protect those whose voices cannot be heard, either because they're suppressed, oppressed, whether it's in Yemen or Palestine or Myanmar or the Yazidis, or the Christians who are suffering at the hands of the Boko Haram. We all have a duty to call people out on bad behavior. Just because you're my friend, you do not condone things that I do that are wrong. You're my friend because you tell me what I do is wrong. And this is why the whole notion of bioethics is so important because we call one another out on bad behavior. True gratitude comes from true remorse. True remorse comes from the understanding that we are inherently grateful, number one, for the friendships we have built over the years, the program that Professor Karmi has so generously trusted, and a very good team, I must say, to actually conduct this program. When I started doing the bioethics program, the first question I asked Russell was, I said, Russell, everybody does this anyway. He said, yes, Shabir, it's there theoretically. Some frameworks are there, but nobody teaches it. Yes. And, you know, I can honestly tell you, I always thought that I kind of read well and I had a good grounding. I actually sat there listening and thinking to myself, oh my God, I really don't know this stuff. And so when I started getting involved in the bioethics program, I learned so much more than I think I had to offer the program. So truly grateful to each and every one of you. I think you're an amazing bunch. The lecture by the economics, the political economist was fascinating. I really enjoyed it, but so do the contributions of all of you. This has been a difficult year, but I can honestly tell you it's a year I learned a hell of a lot. Thank you so much. God bless you all.
Thank you, Professor Shabir. What you said is true. We all learned a lot in all these series of talks, and especially when it comes to the medical profession or health profession, we do not know anything about economy and economics and law. This was a good platform for us to learn about all these things and how they view us. So thank you very much, Professor Shabir. Professor Bello, Professor Leon. Professor Leon is from Argentina. Ariel is there. Ariel will help translate what Professor Leon will have wants to say.
Okay, thank you, Mary.
Thank you,
I want to
Leon.
say 2 words for remember: solidarity and cooperation. Throughout the year, we have developed activities of the most varied types around COVID-19. In the case of the UNESCO Chair and Bio, it is no small thing to have successfully organized and conducted 32 webinars with leading participants from all over the world in 9 months. We have learned to use new technologies which do not replace face-to-face meetings, but which provide a new form of fast, efficient, and simple scientific communication, which I am sure we will continue to improve. What have we learned in this year? We started from individual approach, and step by step, we realized that a global approach was needed to respond to the threat of the coronavirus. And although we have not yet reached perfection, we have improved a lot. Until 2 months ago, we had no idea when we would get the vaccine. Today, there are already at least 4 vaccines that are being applied in many countries of the world. Is it a fair deal? No. It is the best that has been achieved in the current state of international relations. There are still problems which will probably be resolved in the coming months. This is the biggest problem we face as a global village. Before the pandemic, during, and certainly afterwards, there will continue to be at least 3 problems worldwide to which we have not yet found a solution, such as COVID-19. They are inequality, poverty, and climate change. Inequality and poverty. Half the world's population earn between $100 and $150 per month. There are 840 million people with hunger in the world, according to the FAO figure. Food is produced for 12 billion people, and 7,500 billion people suffer from hunger. 2 billion people live in substandard housing without clear water. There is poverty because there is inequality. About the climate change, the United Nations calls for a climate emergency to be declared throughout the world and urgent measures be taken to avoid the greenhouse effect. Glaciers continue to melt. There are new generation of hurricanes, floods, and droughts increase, creating inhospitable areas where it was previously possible to live off crop. Where our contributions? We believe that in a few months, the coronavirus pandemic will be effectively combated. We have learned and are developing international collaboration to make this happen. The challenge related to poverty, inequality, and climate change remain to be faced. If we are able to use the mechanism that we ask to defeat the coronavirus, that is solidarity and cooperation, it is possible that these dramas of humanity will also be eradicated. We believe that the work of the UNESCO Chair in Bioethics has to be conducted in that direction. Thank you.
Thank you, Professor Bello. You didn't really need Ariel. Your English was perfect.
No, you're a liar.
Ariel, thank you very much, Ariel. Would you like to say something? Thank you for being our interpreter multiple times.
It was easier than I thought.
Oh, good. Okay, so you're officially our interpreter for the UNESCO chair. Thank you very much.
Thank you.
Thank you, Professor Bello. May I call upon Professor Joe? Professor Joe has been with us from the beginning, and he's been so faithfully there, irrespective of the time in USA. Professor Joe Thornton has been for practically every webinar. If I'm not mistaken, you haven't missed?
I've missed a few. I've missed a few.
You did? Okay, all right.
I've been awake for a minute.
Yeah.
But thank you very much. I echo what everyone said about the origination maintenance of this webinar series. It's really been outstanding. For my brief comments, I'll put a different perspective or echo what Baroness Finley talked about in terms of relationships. And I'll call it the 3 dimensions of the 6-foot relationship. I started formal training in disaster response about 20 years ago. And at that time, the focus was on bombs or tornadoes, some sudden event. And the head of emergency services says your probability of survival really depends on the person within 6 feet of you at that time. Do they know emergency first aid? Can they get you help? And that still applies for acute events. We think the pandemic is somewhat different, but we learned that the support and threat still depends on the person within 6 feet of you, whether they wear a mask and you wear a mask or they don't wear a mask. Your safety and support and solidarity is within that 6-foot relationship. But the markedly new dimension is that those Zoom meetings are within 6 feet of us so that we have relationships around the world. And for me, this has been critically important because in the USA, I feel, and I don't think I'm alone, that there's been a lethal absence or negative leadership that has adversely impacted the experience of the pandemic. And it's been disconcerting because, again, in disaster work, it's important to work as teams, and we're trained not to circumvent the message from the leadership. But when the leadership is not there or going contrary to what we know is correct, how do we supplement that? How do we not undermine what they do, but provide support for the people around us? And this group is instrumental to help us do that. One, educational, it was very impactful to learn the differences of the educational impact for children, the cost of the pandemic for people, the social cost, and then also how we can draw from the skill sets of each other to help people with information support, emotional support. In the USA, despite the change in administration, which gives hope, the fact is that our votes, we had 70 million people vote for the continuation of the current leadership. So there's a deep social divide. And we find that as we value life, other people value their freedom more than life. And we have to deal with that. So how we work on our relationships. So I appreciate this webinar to open a whole new dimension to support the relationships.
Thank you, Professor Joe. It's lovely. It was really nice to have you on the panel also. Thank you very much.
Thank you. Thank you, Joe.
Yeah. May I, Dr. Kristen? Dr. Kristen represents the nursing fraternity.
Christine and Maureen. Yeah.
Yes.
Thank you, Dr. Mary. It's my pleasure to be here and to have been part of this wonderful series. So I'm from Canada, a nation with approximately 38 million people. I looked this morning, our confirmed COVID cases were over 500,000 with almost 15,000 deaths. Now that's a very small number compared to the world stats of over 80 million confirmed cases and 1.7 million deaths. I'd like to offer a reflection that's a bit more personal. So as a nurse researcher and educator, I'm very much committed to work in the area of moral distress and moral injury, related concepts such as burnout and compassion fatigue, and certainly healthcare worker well-being, as Baroness Finley mentioned. And I think this pandemic has given us an opportunity to really pay attention to some of those concepts, even though they're not new. I see a focus on resilience and growth, as well as compassion, which some folks have mentioned already, and also a renewed commitment to connection and solidarity. So this idea that we're really all in this together, whether it's across an organization, across healthcare sectors, and even across countries. And I also see the opportunity to be part of this community of practice as a way to really inspire a hope-fueled sense of curiosity and creativity, really problem solving and learning from each other. So I thank you for including me in this webinar series and for the unique opportunities to learn from, with, and about each other.
Thank you, Dr. Christine. It was really lovely. It was a pleasure having you and contributing your knowledge to this webinar. Thank you very much.
Thank you, Kristen. Thank you.
Professor Pierre? Professor Pierre Effa? Is Professor Pierre there?
You want
Yes,
Oh,
I'm
lovely.
okay.
Yeah, Professor Pierre.
Yes,
Yes, I'm
lovely to
okay.
see you, Professor.
Okay, thank you so much.
Okay. Can you tell us about your reflections of the webinar for this year,
The series, the
the
program.
series?
The whole series?
Yeah,
Wow,
Whatever you attended.
Was-
many
whichever
of
you
them.
attended.
it's amazing. It's fantastic. This is really a very, very important initiative. And what I learned from this webinars help a lot in my idea, my behavior in this pandemic. And I try also to share my experience with around me, with my country, colleagues, and so on. And at this step, the question is to know how far we'll go with this experience. Will we stop it, or will go on reflecting, sharing experiences? Because this seems to be the beginning of a new world.
Yes.
We'll have a lot of change in the future from this experience. So a strong organization, a worldwide organization as our chair, I think must go on working on in this perspective, to go on sharing.
Yes.
Because we have still a lot to know, to learn about this new situation.
Yes. Thank you, Professor Pierre. That's exactly
Thank you, Professor Pierre.
everyone's mind. In fact, there's a question also, I mean, a statement rather, will we continue this COVID pandemic into 2021? We can hope that we will see an end to this with the vaccination, hopefully. And that's the best we can do right now. Thank you very much, Professor Pierre.
Thank you, Pierre.
Okay,
for
thank you.
joining us. Yep.
Professor Alvin?
Yes.
Professor Alvin, yes. Your reflect. I want everyone to know in this, whoever's in this webinar, that Professor Alvin took part in this webinar when his daughter was getting married, during the time when his daughter was getting married. So you can imagine
from
his...
the wedding, from the
actual venue of the wedding. He was contributing to the session, to the webinar series, and that really demonstrates the amount of commitment he has and his friendship with Professor Russell. Professor Alvin.
And also my friendship with you, Professor Mary.
Yes, yes, definitely.
And so my gratitude to Professor Derek.
Yes.
He's so DIY kind of doctor and professor, you know, and we really have to learn from all of you. And I really have a lot of things that I had learned throughout the participation in the webinars for the latter part of this year, I think. Of course, I thank Professor Gerard a lot. Last week and also this week's presentation is very enlightening and refreshing. But I really had learned a lot from what Professor Russell had emphasized all along. I think in the past, perhaps many doctors had omitted or neglected the needs of the psychological and spiritual aspect of our management, of our patients, and in fact, the society as a whole. We always have to deal with the politicians. You know, the politicians are not very kind to us very often, very manipulative, but then we face the negative thoughts and feelings of our patients and the society as a whole. Most of the people had demanded doctors so much, and sometimes very unnecessary or unfriendly demands. You know, I had a very good friend, a dermatologist. In fact, I'm so sorry to say he had committed suicide at the beginning of this month. Yeah, I was so sorry. He was having a sort of a smiling depression. That is, he had masked depression. He received so much negative energy from all his patients. You know, as a dermatologist, many people are so concerned about their appearances, and in the COVID-19 pandemic, they could not have the, timely follow-up and care of their skin, and they are so depressed. And the negative energy of these patients, in fact, had accumulated in my friend's heart. And he's passionate, you know. The problem is he's very passionate. He's very passionate, and he felt all the sadness of his patients. And then he could not sort out help from his friends, not even me. I'm so sorry to say, I'm his good friend. I often talk to him, we sing together. But then his wife also had missed the trough of his emotional mood. So after one very long day, after several patients had complained so much and grumbled to him so much, right after his consultation hours, the CCTV had caught his facial expression, how desperate he was, how sad he was. And then that night he jumped without telling his wife and also his friends. So I was very saddened by his leaving. Well, of course, that said, I think we are not omnipotent. We are not God. We cannot play God. And what I really mean is we have to care for our people around us. And sometimes, especially doctors, you know, there's a recent study in Hong Kong's teachers. 85% of the teachers were depressed and very unhappy. Also, virtual learning for all the students, and he could not have contact with his students. And he had all the students had all the pressure and the stress on virtual learning, you know, and they have to have virtual teaching. So in fact, I think most of the doctors, perhaps much more than 85% of doctors had a little bit of depression at this. I think, I'm so sorry I had talked about this, but that's what's happening in Hong Kong. You know, at the beginning, Hong Kong had been very complacent that we had managed the first wave and second wave of our COVID-19 pandemic quite well. And no doctors had been infected during work or through our service. But however, for the recent month, there are a dozen of doctors got infected already, and one, in fact, was sent into the ICU. And well, we had nothing to be complacent of. And so Hong Kong doctors had a lot of things to learn. And I think one important thing we perhaps have to learn from Professor D'Souza, how to incorporate the psychological well-being and spiritual well-being and training and CME, CPD for doctors and nurses, and how to succeed in the multidisciplinary cooperation and collaboration, not just nurses and pharmaceuticals, pharmacists, but also even, in fact, engineers, social workers, and you know, even mechanics and counselors. So we just have expertise in one field, that is the medical field. But helping people in pandemic, we really need concerted efforts for many disciplines. And so that's why I think Professor D'Souza and Professor Mary, your endeavors to help doctors all over the world, go globally, to overcome this pandemic challenges is very important. So I had in fact introduced to many of our students and also colleagues in Hong Kong. But of course, having said that, we all have to face our unique challenges in our own area. So I think in this platform, thank you very much that we could have the encouragement from different countries, different areas, ethical, ethnic backgrounds, and social background. Thank you very much. Sorry, I had taken a longer time than expected.
That's okay. Professor Alban, your video also has gone off. Thank you very much.
Thank you very much.
You're really correct. We have to look out for each other. That's very important because we miss the signs of, and especially as a teacher, as a medical teacher also, it affects our students, our medical students. So we have to have systems in place, support systems in place for not only the students, but also for our staff. That is very important. Thank you very much for your contribution.
And I would also like to say that, in fact, we have been facing a lot of challenges from other disciplines, including, say, we have oppositional views from, say, Great Barrington's declaration against the conventional, our efforts, I mean, in WHO and in our mainstream medical field. But not only that, but also from all those alternative medicine people, they doubting the vaccines, they are doubting the Western medicine, etc. So we have to love our enemies. Sorry to say, perhaps they are really like our enemies, but then we have to know them, to understand them, and perhaps to convince our population-wise audience how to choose the right thing to do. I think that is very important, and we have to stay cool-minded. And
yes, that's true. That's true, because we were getting conflicting reports even from the medical fraternity. So that was also creating a lot of confusion. You're absolutely right.
We saw all that in our webinars, isn't it?
Yes,
we saw a bit of that.
yeah.
But we also catered to, we had the spiritual domain also into our webinars. It went on for 2 years. We looked at
one
all
of the
those
rarest webinars and most difficult webinars that I moderated was the interfaith webinars. You know, but we learn from all this. Thank you. Thank you.
Yeah, but this is a very, very meaningful and
Yes.
productive platform. Thank you
Yes.
very much.
Thank you, Professor Albert.
Thank you, Alvin.
Professor Shailendra is there? Professor Shailendra Saraf?
Professor
are you there?
Shailendra?
I'm just checking.
He's
Can you
there.
see if he's
Yes,
on?
he's there.
Is he able to talk with
Dr.
you?
Shailendra?
I've sent him a request to.
Okay, then I will
You
go
can come back.
to
Yeah.
yeah.
Stacy or
I will go to Stacy. Professor Stacy, you've been with us, sometimes even holding our hands and supporting us and giving us advice. Yeah.
It's
You're
been my pleasure.
Yeah.
Thank you. Thank you. First and foremost, thank you so much for putting this together. I echo the sentiments of everyone else here. I don't know how you've managed to put all of this together week after week after week at all hours of the day and night, but it's nothing short of miraculous. And I think I speak for everyone when I say we are all so appreciative of all of your hard work. So thank you to Dr. Russell and Mary and Derek. We really appreciate everything that you've done for us. So thank you so much. I just wanted to say, also from a personal note, I think when this all started, there was, for people like us in the helping professions, right? We want to help, we want to do more. And so when this first happened, I remember watching the first webinar and saying, this is amazing. This is something that we can be doing. This is something where we can all get together and we can kind of work through this in a way that is going to actually educate and empower people all throughout the world. And to me, that seemed like such a wonderful and unique experience. And here we are at the end of the year, and I still feel that this has been a wonderful and unique experience. I think that, you know, Professor Thornton said, at least here in the US, there's been a lack of leadership from the government. And when we have a lack of leadership, it creates a need for a robust public health system that's built on a strong ethical foundation. And so I think that all of us here, all the conversations that we've been having, medical practice doesn't exist in a vacuum, right? It exists in a larger context. And, you know, the things that I keep hearing over and over and over again, you know, are all these other aspects that contribute to the things that we're dealing with. So that aren't strictly medical, whether they're, you know, climate change has been mentioned, and so have the, you know, and inequalities that we've been dealing with for such a long time that aren't new. They've just been heightened by this pandemic. And this has given us such a wonderful opportunity to explore all of these different aspects and how they kind of play into the larger role of health and well-being of the individual. So the two main principles for me that always underlie my work is human dignity. So as members of humankind, I feel that we are all entitled to be treated with dignity and respect, but that also means that we have a responsibility to others to treat them with dignity and respect. And this pandemic has really brought that home on a new level. And the other thing that guides a lot of my work as someone who deals with bioethics in the Holocaust is the importance of remembering the past in order to protect the future. We have to know what has come before us. We have to know what is happening in other areas of the world in order to understand what's happening now and how we can go about kind of improving that. So sharing knowledge on a global level, because everyone everywhere on the planet is dealing with this, is so important in terms of understanding that we can't let this catastrophe ethics take over. We have to be true to our ethical foundations. We have to ensure that we're not repeating the same mistakes of the past in terms of, you know, protecting marginalized and vulnerable populations, issues of access and equity to care, the ethics of research and practice, both when we talk about at the beginning allocating scarce resources and now when we're talking about vaccine distribution, the opportunity to have these discussions about the role of the doctor in caring for the individual versus the role that we have in terms of caring for society, debates about whether or not the value of human life is worth the economic cost of the shutdown. For me, that was a really, really meaningful webinar that we had. These are things that have to be addressed by those who are directly impacted, all of us, not necessarily the government, right? Because sometimes we see the government's not addressing them at all. And sometimes the government's addressing them from a place that isn't coming from fact, but is more coming from political propaganda. So that's really what this webinar series has provided, this opportunity for cooperation, solidarity, learning from each other. And I know I'm getting ahead of the second part when we talk about gratitude. I'm so appreciative of this opportunity. And really, to me, I hope that we're able to contain this pandemic and that life, excuse me, I'm sorry, can somewhat, return to what it was like before. But that one thing we're able to hold on to in this, new post-pandemic world is this ability to all kind of work together and continue to share our knowledge, internationally, because it's really, it's been such a gift. So I just, again, want to thank not only the organizers who've done a wonderful job, but everyone who's participated and shared their knowledge. And really, it's been wonderful. So thank you so much. And a happy and healthy and wonderful new year to all of you.
Thank you, Stacey. Thank you so much. I think we've had such a variety of topics and panelists and people. I don't know if many of you had attended the one where we had teachers, school teachers and the children. That was one of the most, students. That was one of the most beautiful webinars, that it was really heartwarming to see the children's views on what this pandemic has done to them. So we've really had quite a variety of topics. Yes, Dr. Rasim.
And I think education was,
education, yes, we did. Yeah.
And I think Harold will be talking on that.
Yeah. May I ask Dr. Miriam? Dr. Miriam? Can you hear us?
Yes, I can hear you.
Oh,
thank
okay.
you. Yeah.
Dr. Miriam is from Kenya, right?
Yes, from Kenya. Yes, thank you so much.
Yeah.
A very good morning and very early morning and a good afternoon and a good evening to distinguished panelists and our esteemed guests. I truly want to appreciate the webinar lead and Chair Prof. Roussel for excellent coordination, and Prof. Mary, you have been exceptional moderator, and Professor Derek has been really outstanding in his command of the chat system. Thank you so much. I think I want to start by giving us a quote by Albert Switzer. Albert Switzer says as follows: "At times our own light goes out and is rekindled by a spark from another person." Each of us has cause to think with the deep gratitude of those who have lighted the flame within us. So with this, then I want to reflect on the initial lockdown in Kenya when the university closed and universities elsewhere closed. But then quickly the ICT systems within the universities put things together and ensured that systems were in place. And so then the teaching went on. It went on to the extent that now there were practicals and there were also examinations and students were able to graduate. And I think that was a very good, very well done for the ICT in whichever country they came from. Then I want to look at the government's applications of authority. Within the authority, I think that we saw the ethical principles sometimes contradicting each other. For example, the ethical principle of beneficence. The governments are supposed to ensure that activities and policies they put in place benefit their people. But at the same time, there was some harm that was being caused, because for the poor people who depended on casual work, they lost a lot of income.
Livelihood.
Yes, and then there was the issue of issuing some kind of livelihood, some kind of food stuff. People ended up coming together, trampling over one another, and then there were deaths. We also saw governments who whose rulers did not want to lock down. And so we saw also the pain that the citizens had to go through, because there are those who are sick. The the status of COVID in those countries were never announced. The protective equipment were never facilitated. So then again, people lost their lives. But on the other hand, they may not have lost a lot of employment like the governments which took lockdown. We also saw that contradictory statements from the scientists when the scientists were talking differently from one another. We saw that we do not have monopoly of knowledge. We saw the WHO giving policies and sometimes changing them. And we saw the government of the ministries of health, for example, in Kenya, concentrating on some cadre of professional groups and forgetting that all cadres are required for interventions in this pandemic. And I'll say, for example, when we had these webinars, we saw the nurses and their concerns. We saw the pharmacists and their concerns. And then we realized that the biomedicals did not think about the social and the psychological aspects of this preventive strategies that were put in place. And this had effects on people now having a lot of dilemmas, people having distress, people having many other psychological issues came in. So we learned that in as much as there is a pandemic and there's a threat and everybody is worried, it is important that we have all the team players and everybody works together. We saw also government systems which concentrated in pandemics at the expense of immunizations, other NCDs, and HIV/AIDS. So the question then we shall be thinking about when we reflect on all this is how then do we handle future pandemics in a situation that we take care of the spiritual aspects, we take care of the social aspects, we take care of the existing medical conditions, and how do we then handle loss of employment and poverty? I want to talk about nursing as a discipline last. We know that the year 2020 was designated by WHO as the year of the nurse and the midwife. We were all thinking on how do we want to celebrate this year. Then the pandemic came in to put nursing at the limelight. And we have seen, for example, in countries like UK, where the Prime Minister, Honorable Boris Johnson, singled out many people who looked after him, but among them, the 2 nurses, ICU nurses stood out, which is not usual. And also in Kenya, we've seen many nurses now getting recognition from the head of state are being awarded. So we feel that somehow in the midst of this suffering, nursing has also been brought to the limelight.
Yes.
Then we realized that, there were some of the guidelines that had to come out. So again, I really appreciate this webinar because it is out of these webinars that the team led by Prof. Russell and Mary yourself and Derek came up with the idea that we are supposed to come up with guidelines. We hope that those guidelines will help sort out some of the issues that we have had. Then we saw the nurses reflecting on fundamentals of ethics of professional nursing care. The nurses were asking, how do we balance the fear of contracting this pandemic, the increased workload, the vicarious trauma, and our duty to care? That caused a bit of dilemma. And then the principle of veracity. How do you tell the relatives that your patient is getting worse and your patient will die? It became a big problem. But we saw UNESCO and some teams as a spark that rekindled our own lights. We've talked about the ICT coming in with systems that ensured that we didn't come to a standstill. These webinars are a product of a working ICT or technology. We have seen the multidisciplinary and intercountry, and indeed the whole world coming in together, panelists sharing their experiences. Many times we tell patients you are not alone in this, and we introduce patients to some other members who have the same problem. But we saw it working on us because this time we were sharing our experiences as various experts on how now to move on with our various duties, so that we also felt that we were not alone. And I'm glad that you are renewing this webinar series in the year 2021. And I really want to appreciate each panelist who came in, the guests, and most importantly, the coordinators led by Prof. Rosel. Mary, you have been a very great person, and Derek, thank you so much.
Thank you, Dr. Miriam. Thank you so much. It's really, I think the nursing fraternity were the foot soldiers in all this. I think no one, they quietly came, did their work. Nobody actually knew how much trauma they also went through. So I think it was beautiful to listen to all their experiences and of course come out with a guideline. That is the good part of these webinars, coming out with a white paper and coming out with a guideline in different disciplines, so that this will never, the next, if God forbid, but if it happens again, we are prepared, we are better prepared. Thank you very much, Dr. Miriam. Professor Vivian, are you there? Yes.
Yes, I'm here. Hello.
All right.
Yeah, thank you.
I've
Welcome.
really enjoyed listening to everyone this afternoon, and everyone who participated in some of those previous webinars that I was able to attend, and obviously very grateful to all those who've been involved in organising these webinars. And I can't help but think that the expression 2020 hindsight has taken on a more significant meaning because of these webinars, because the world will never be the same, as other people have reflected. And as our First Minister in Wales commented, this is a very cruel virus. It challenges every one of us because it thrives on our normal human behaviour. The normal human behavior of wanting to meet friends and family and be together. But one of the things that has emerged in the UK is, I think, a sort of a greater caring among communities. You know, one of our poets in England, Wordsworth, what he called those little nameless, unremembered acts of kindness and of love. So we've seen neighbours looking after neighbours. We've seen people volunteering, giving up their time, completely unpaid, to care for one another. And that's a really, really life-enhancing thing to see. One of the emerging themes throughout what people have said today is that of equality or inequality. And it brought to mind, in fact, the great American moral and political philosopher, John Rawls, who developed his theory of justice, in which he said that he would accept or permit inequalities in the distribution of goods, which would include life chances, but only if those inequalities benefited the least equal in society, the least advantaged in society. And it's been very apparent that the poorest people living in crowded communities with very little money, often in despair, are those who've suffered even more than everybody else. And I think the world has responsibilities. So my colleague, Professor Finlay, talked about what's been happening in the UK and how we have been learning, finally, about the pandemic. But I would like to consider just briefly the emerging issues for 2021, because they will obviously be emerging learning about the virus and its variants. And I'm absolutely in awe of all the scientists who've contributed, because there's so much to learn all the time. You know, it's a little bit like Newton when he talked about, you know, playing on the shore as a boy, whilst the great ocean of truth lay all undiscovered before him. because so much has been learned about this in such a short time. But there will be a large number of ethical issues, dilemmas arising about, as has been mentioned, vaccinations and the rebalancing of economies. You know, it's always been a mystery to me why footballers earn more than nurses. You know, what have they done other than being able to kick a ball around? And I don't mean to be rude. It's a very entertaining, very worthwhile sport. But in terms of financial reward, it seems grossly unfair that they should be able to earn millions of pounds or dollars while nurses are very poorly paid. So that is from a lawyer. Incidentally, I am a lawyer. And the people who need to learn, and I think this is very, very important from this opportunity, from these webinars, is that the role of bioethics needs to be raised, the profile needs to be raised, because our decision makers, our judges, our legislators are making decisions which should be informed by bioethics. But although in the UK we have an ethics committee or panel in each of the countries of the UK, it's very seldom that you see a decision being made and explained to the population in terms of ethics and doing what is right, doing what we, you know, what we should do, what we ought to do rather than what we want to do. And also talking about those ethical issues which underpin or ought to underpin decision making. The talk is always about the science or the economy rather than the ethics. So that is very, very important. And thank you so much, Professor Russell, for this, because it's given us, you know, a new opportunity to reevaluate and rethink the world, the whole world. So it's obvious that there is a more collaborative approach emerging, and I hope we see that developing in 2021. So thank you again.
Thank you, Professor Vivian. You gave a whole new different perspective to the medical fraternity to think about, you know, because we are so focused on just health and only health. So that was a beautiful. Yes,
yeah,
sir.
Vivian, Professor Vivian Hartwood represented or came from the health law perspective, and she took part in the political economy and so many other ones. So thank you very much for that important contribution and your contribution to the Department of Education in the courses and so forth. Very appreciative of that too. Yeah.
Is Professor Richa there? Professor Richa?
Yeah, Professor Richa should be.
Yes, ma'am.
Yeah.
Good. Can you open your right? That's it.
Madam
She's
represents
the
the pharmacy discipline.
Secretary of the committee, yeah.
So namaskar to everyone, and I am truly honored and privileged to be a part of this wonderful webinar series, and I admire the whole entire team of Dr. Russell, Dr. Matthew, and Dr. Derek D'Souza, who had been persistent and committed to bring or to provide a platform to various thinkers across the globe, and to provide a platform to have a thought-provoking sessions and on various topics which the learned people, the learned scholars around the world could find out some time and share their experiences, share their thought process on the learnings from this COVID situation that has created an great adversity across the world. And we have already we know that whenever there is a situation of adversity, it brings about a lot of disruption as well as gives an opportunity for new discoveries as well. So discoveries, and that is the I think the objective of education. Dr. Russell D'Souza, who is representing the UNESCO Department of Education, and that is the whole purpose of education for that matter, that how we can provide a platform for new ideas, how we can collate the learnings for new developments, which can bring about a positive change in the society. So before pre-COVID situation, everyone was very much busy and scheduled to do their routine work, and were all very much materialistic for that matter. And but this COVID has made us, or push us to think about the various bioethical concerns, the various ethical concerns for that matter. And also see, earlier the rich never use the institutions of public health, but this COVID situation, we have experienced that even the richest of the rich is looking forward for some information from the public health institutions. And of course, it was assumed that the issues of public health were more impacted towards the poor and the rural areas. But this particular situation, or the particular pandemic that we had seen for almost an year as of now, it has also pushed the governments to invest on public health institutions, including epidemiology and research and development and public health delivery systems. So it gave the pharma industry an opportunity to be resilient, be innovative, be proactive, and be prepared for the unexpected through the research and development, through the clinical trials. And it also exposed or shown us that collaboration and associations are the key to move forward. As we know, for the fast development of vaccine also, collaboration is the key. So yes, definitely this COVID situation has explored or made us explore new ways of finding out high quality yet affordable solutions for healthcare. And I congratulate the whole UNESCO Department of Education Bioethics Haifa team for giving us this platform and making us think about the various co-health workers of representing various fraternities, or being it nursing, being it dental, being it physiotherapy, being it pharmacy, being it medicine, even the genetics, the gene engineering and all those aspects as well. And also keeping in mind the bioethical concerns of solidarity and the key principles of bioethics and equity, equality, social justice, and things like that, which being healthcare professionals, somewhere we were lacking with in our thought process. So we had learned it, but we were lacking in the thought process. So I congratulate each and everyone. And Dr. Mary Matthew has, you are wonderful and you are inspiring. And the way you have handled the webinar series, and so persistently, without fail, this webinar is, successful. And I congratulate everyone, and to the participants as well who find out time to share their views, share their thought process, and give us new learnings and new outcomes. So thank you one and all. Thanks.
Thank you, Professor Richa.
Thank
Really
you,
wonderful to have the pharmacy fraternity come in and discuss their problems, without which actually we wouldn't have thought about it. But this vaccine has really pushed different disciplines into the limelight. So that is the good thing that has come out of all.
And we had an achievement also out of the pharmacy webinar. We could bring out the guidelines as well.
Yes.
So
we got
that is
international guidelines by an expert committee that was brought from our platform of 3 webinars of the pharmacy discipline from around the world, participated and contributed to the development of these guidelines, which are now being circulated through the International Pharmacy Federation. Is that right? That's being circulated to all the world. And that was on this platform that we built the new expert guidelines on ethics for pharmacy. Thank you very much, Richa.
Thank you, sir. Pleasure.
Thank you.
Professor Poo, Vishnu, I know you've been waiting.
And Vishnu,
She
represents
represents the physiotherapy, the allied health. Yes, she
And
represents the allied
they've
health.
had two webinars where they brought all the physiotherapy from around the world to join us.
Yes. Your reflections.
Very good morning, afternoon, and evening, everyone. I would like to take this opportunity to thank Dr. Russell D'Souza and team for giving this opportunity to summarize the reflection on UNESCO Bioethics Webinar Series 2020. One of the most enduring qualities of being human is our ability to express our gratitude, but that is something that we often miss out. I look back at the happenings of physiotherapists faced in 2020 during the COVID pandemic, I look back at the happenings that physiotherapists faced in 2020 during the COVID pandemic, experienced infections by ourselves, loss of jobs, salary cuts, worked through loneliness, quarantine and isolation, premature loss of loved ones, working odd hours in COVID ward, virtual teaching and learning, and newer methods of assessment and evaluation, growing the resilience and realizing that we live in a broken world and things may be perfect in future. The Department of Education UNESCO Chair in Bioethics 2020 series on COVID-19 on every Sunday gave a good learning experience on difficult choices around resource allocation, inequalities faced by marginalized population, need to protect vulnerable population, addressing updates and ethics about COVID vaccine, problems faced by teachers and students in teaching and learning, psychological, economic, and interfaith issues. An exclusive webinar on ethical issues faced by physiotherapists during COVID-19 pandemic gave a platform for guided discussion, provided an opportunity for sharing insight and identifying activities to effectively address key ethical issues through a multidisciplinary and cross-regional approach. This year of 2020 afforded time to turn inwards to engage in reflection and mindfulness, which in turn become a beacon of light, spreading hope in this tough time. I hope we carry with us the act of kindness we have heard of and witnessed during this time. May we remember the resilience of human spirit and try to evaluate those who have been as a light in darker times. I hope we remember that our action really do matter. When this is all said and done, let's cherish the beauty of new normal, stay hopeful, friends. Thank you.
Thank you very much, Vishnu. Madam is from the physiotherapy fraternity. Dr. Russell.
The physiotherapy program with our chair.
Yeah. Dr. Russell, shall we ask Professor Harold to come in now?
Yes, good.
Professor Harold, are you there? Are you still there?
Yes.
Indeed I am.
There you are. Okay.
Absolutely.
So Professor Harold, you will be giving us a short...
on the pandemic of false choices.
Yes.
I think that's a very good, it coincides with our work with education and the schools and colleges. We gave 2-3 webinars that were focused on that.
Yes. And I'm going to be sharing my screen, so I hope that that will make following with me a little bit easier. Although I do not need a translator, as my daughter says, Dad, you came here to the United States at the age of 9. Why do you still speak with an accent? And I say to her, Zoe, I'm a psychiatrist. Thank you, Russell, Mary, Derek, for again continuing my own adult education, and thank you, Amnon, for so many years ago inspiring me to be the founder of the first unit in the United States. I still remember when we sat together and surrounded by the beautiful art at your home, and as we talked about it. I come to you today in grief. At this time, last Sunday, I learned that Steve Vogel's father, Steve is my cousin, but his father and I own this. He's my cousin once removed, as well was also my cousin, Ezra Vogel, who some of you may know. He was the renowned scholar of Japan and China, also a diplomat who really worked to bring people together. Unexpectedly died at the age of 90 as a complication of a very minor surgical procedure, which is still difficult to understand. Even though he was 90, he would walk a mile a day, bicycle 20 miles. And yes, he said, I probably still have about 10 more years, 10 more good years in me. So again, a death at any age is not easy. And a death by someone who was such a friend and touched so many people all over the world and would have so much approved of the work that you all do, that we are all doing together, is a matter of grief. So forgive me if I speak still from a position of grief. However, I would not miss this seminar under any circumstances, because education itself is a form of consolation for grief, and especially bioethical education. There's different disputes about how did philosophy, Western philosophy at least, begin. But at least one version of it is the Western philosophy began as in the midst of consolation for grief. The last Socratic dialogue, which was before Plato took over, was called Phaedo, which was a conversation with Socrates on the night before his death. And from that, and by the way, Socrates did not win that argument. And most commentators say that Socrates was arguing for immortality, but eventually part of the argument, if you follow the Phaedo, is to be able to accept his own mortality. He loses the argument, but basically wins the truth, which I think we have touched on today. And surely the truth is itself a deep bioethical value. But the truth can only be achieved through learning, because learning can only be achieved through education. And what we have been trying to do, and thanks to Amnon's leadership, Russell's leadership, the work that Mary and Derek have been doing, is to go ahead and make sure that education does not become yet one more piece of collateral damage. Because a pandemic's effects are in some ways like dropping a pebble into a pond. There's the pebble which goes down, but then there's all the ripple effects, and the ripple effects occur both in the present, but also across generations. And education is our best vaccination against the virus of ignorance and arrogance that can often follow a pandemic. And we've seen it time and time again. So my first slide, which was a slide which was which is a circle of children, and you can see the coronavirus there. Now, what's that about? How many of you remember Ring Around the Rosie, Pocket Full of Posy, Ashes, Ashes, All Fall Down? That's a children's song. Do you know where it came from? It came from the Black Death. This is what they were describing. People dying, basically. People dying from the Black Death, the various steps. First came the ring, then the attempt to treat around the ring, and then people died. This was the Black Death. This was the bubonic plague. And at that point in time, there was no way to go ahead and to treat the ripple effects of the transgenerational transmission of trauma and the kind of toxic resilience that followed trauma. So thus, as I had mentioned in one of my prior presentations, that one of the best studies that has come out by two German economists shows that the people who voted for Adolf Hitler the most in 1933 in Germany were the people who came from the same medieval regions where the Black Death was at its worst, and then later on in 1918, where the Spanish flu was at its worst. So that again, we cannot allow education to be a casualty. At the same time, what we have been able to do is, I know you've been able to continue my own adult education, and I've used these seminars to go ahead and to be able to continue my own studies and reflections with some very gifted collaborators. So we've been able to at least focus on education as being vital. This includes this publication, A Pandemic of False Choices, which appeared in the Psychiatric Times, which is the most widely read publication by psychiatrists both in the United States and perhaps even worldwide. But again, the reason for this publication is your inspiration. And also, I must say, my cousin Ezra Vogel's inspiration, which has been a kind of consolation in these very dark times. So what is the pandemic of false choices? Well, the SARS COVID pandemic has exposed a series of very critical.
Harold, sorry to interrupt you. Are you sharing your PDF, or because we're not seeing anything?
No, I have a share screen, share alt, but let's see, multiple, advance, should I do, oh, I see, multiple. Okay, let me try. Can you see it now?
Not yet, Professor Harold.
Advanced sharing options. Who can share? All participants, okay.
No, on your screen, you should have a green box which says share screen. Just click on that.
I am, and let me try again. How is this?
Yes, it's coming up.
Thank you for being continuing my own technologically perplexed education. You're my guide.
we thought you were just speaking. Okay, all right.
Yeah. So this is the ring around the Posey packet full of Posey.
Yes.
Yes, which again was this is the way this became the transgenerational transmission of perhaps healthy resilience. At least there was a song to it. There was a merriment to it. You take grief and you convert it into something which children can be comforted by, right? Children can play with. But again, we have to do. We can't leave it at just this. So teaching and education is absolutely vital. Historically, education has been inequitable in its distribution of resources. It serves not only as a source of scholarly, but also a facilitator of nutritional security. Kids eat lunches, right? At school very often. This is where many, many kids have the only good meal of the day. It is also a place for safety, monitoring, well-being, and it's a connection of services to a variety of family systems. Now, having said that, what has happened is that the people who are most at risk in schools are school teachers from the coronavirus. And many school teachers themselves have really been very reluctant to be able to go back to in-person teaching. And of course, we try our best by Zoom. And this works for us because we know we've been learning about its limitations. We can go ahead and to some extent work with it. By the way, I hope that everyone is having a cup of coffee or tea or something like that as you're listening to me, because I think, even as we grieve, we have to eat and nutrition is important, right? But for kids, it's absolutely vital. For kids, it's absolutely vital to be in an environment where there's other kids and there's school teachers and their parents can go ahead and go to work in peace. When parents, so I think the emphasis on who's an essential worker has to be extended to include teachers, especially school teachers. If school teachers are not prioritized in the healthcare system and who gets the vaccine, especially vulnerable school teachers, then what we are asking is to divide children from families, because the tensions that can exist in family environments where kids who usually go to school don't go to school are absolutely horrendous. There is an acknowledgement that there's a mental health crisis coming, which will come on the heels, even as it's of the pandemic peak, which may drive eventually over time deaths of despair in equal or even greater proportion to the deaths which have been caused by COVID directly. Now, the problem is that for many families, as long as the kids cannot go to school, what we have is a series of what have been called by my friend R.J. Lifton, and others, choiceless choices. Or as Guido Calabresi, the American jurisprudence scholar and judge, who once reviewed a case in which I testified in, actually. I'm glad to say I learned a lot from his review. But what he called tragic choices. We cannot make families be faced with tragic choices. Either I go to work, or I try to work at home even, and not pay attention to my kids' schooling. Oh, my kids won't learn. That's just not fair. It's not equitable. We cannot sacrifice one generation for another generation. We must not sacrifice the elderly for the young, nor must we go ahead and sacrifice the young for the elderly.
Yes.
Unless we really go ahead and realize that, especially on the elementary and high school level, but teachers are essential workers. We are going to go ahead and have more ring around the rosy packet full of posy, ashes, ashes, all fall down, but not in this generation, and maybe even not in the next generation. The ripple effects will occur across generations. And we must not forget the future, even as we grieve in the present and remember the past. Very, very vital. Let me see if I can just move this here. Let's see. How to shift. There we go. In terms, we also need to find new ways to teach, and to teach via Zoom. The so-called Zoom fatigue is not a phenomena which should be dismissed or taken lightly. There is something about focusing and hyper-focusing on people's faces, which makes the person who's being observed conscious and distracts the observer. One reason why, when I'm not speaking, I tend to go ahead and just shut my screen off. Because I really want to listen to what's being said. I don't want to go ahead and be, and there's such a human response when someone's looking at you. You begin to think of how am I looking, or when you're looking at someone, you begin to think of how do they look per se. We don't want to go ahead and become a performance society. We want to go ahead and be a community of listeners, not just of performers per se, although performance is important. Otherwise, there becomes a huge overemphasis on performance, and then what you get is a kind of malignant competition and perfectionism, which is especially in grief. This is illustrated by, again, one of my favorite artists, the artist Hyman Bloom, where he portrayed Marsyas. Marsyas was, as I have mentioned previously, a Greek satyr who thought he was the world's best musician. He challenged the god Apollo, the Greek god of art and music, to a contest. Apollo wanted to decline, but Marsyas insisted. So Apollo said, well, okay, I'll compete with you, but if I win, I'll get to flay you alive. Well, guess who won? Apollo won. Marsyas gets flayed alive. That's in terms of competition between people, between nations, when competition goes from being friendly to being malignant because of a kind of perfectionism. At the same time, we have to be aware of that internal perfectionism. I know one of the speakers mentioned a colleague of his who committed suicide. I've been treating colleagues. And one of the problems is all of us who are in this field have a passion to excel. Otherwise, we wouldn't be here, right? But that passion to excel means that we can go ahead and get into a malignant competition with ourselves if we hold perfectionism as a standard. When we have to go ahead and do triage with time, which happens with COVID, I have to remember now which I have to put a mask on before I go into a crowded place. Where my patients have to remember how to apportion their time. Is it going to be time spent with their kids or time spent at work when you have an educational system that's really been terribly destabilized? Under those conditions, if we are perfectionists, then we begin to really skin ourselves alive. So I think we have to be aware that without attention to the educational system, many families where people have a passion to excel, the parents will be torn within themselves. Where do I go ahead and focus my energies? On my work, on my patients, on my children? How do I do it? And then life becomes near impossible. So again, what is the way to address this? Again, this is a painting by my old friend, Hyman Bloom, of a rabbi who was saving the Torah in the midst of grief, in the midst of fear. We must not deprioritize learning. We must not deprioritize teachers. Rabbi in Jewish means teacher. That's how it means. It means teacher, right? A teacher is an essential worker. I think if we lose that theme, we are in danger not only of compounding the grief and despair that people feel, but also that sense of helplessness and hopelessness about the future. We must not go ahead and forget our teachers, just as we must not forget our heroes. Teachers are heroes in the midst of a pandemic. Again, thank you for the consolation and the inspiration of these seminars. Thank you for continuing the work of bringing people together via education, even in the midst of grief and loss. And we look forward with more hope towards 2021.
Thank you, Professor Harold. It's really beautiful. You know, I love art and I love the way you relate to art and to express a lot of what we are feeling. Thank you very much. You could stop sharing the screen so that we can see everyone, if you could do that.
I hope so. I shall do my best. I shall do my best here.
Devi, we are running out of time. So what we're going to do, can we get that on the video on gratitude?
Yes.
Professor Harold, you just have to say stop sharing. That's it, and it will stop.
It will stop. All right.
Yeah. Stop share.
Stop share. Oh wait, plus share. How's this? Did that do it?
Yes. Oh no. Oh yes. Correct.
We'll continue my
I pushed it down.
You pushed it out. Okay. Okay. So.
Okay, Derek, can you get that? We're going to Mary. Is that all right? We want to end now. A quick reflection on gratitude, a very important part. As I said, for the most of history, it has remained a discussion for pastors, but science has now brought this to the, given us much more important aspects. The growing field shows the benefits of cultivating an attitude of gratitude are very real and can be enjoyed outside the religious context. And a large body of scientific data now on the nature of gratitude, it causes its potential consequences for human health and well-being are now available. And what we realize, scientists are the late comers to the concept of gratitude. And gratitude was the forgotten factor in happiness research, because what we see is that through leading universities conducting highly focused, cutting-edge studies on the nature of gratitude, its causes and consequences, important scientific light on the important concept is now available. And of course, these talks are intended to provide some introductory overview on the major findings. Now let's quickly look at how do we where does it come from? And if we could look at some of these, gratitude is the mother of all emotions, is a healthy socio-moral attitude that directs the targets at building and sustaining social bonding and reinforces pro-social responses in the future. And what we see, there are a number of benefits that have come from empirical studies on this very area, which I don't have time to go through, but to briefly look at what evidence we have in terms of benefits of gratitude. All this comes from some empirical data, and of course, physical, psychological, and other well-being. So it serves many areas that can be used, but important when we define gratitude, it's feelings of thankfulness or appreciation has two parts. The first part is an affirmation of goodness, and we affirm that there are good things in this world, gifts and benefits received. And the second part of understanding or defining gratitude, we recognize the source of this goodness is indeed outside ourselves. So there is self-transcendence, and we acknowledge other people or even a higher power for some have given us gifts, big and small, to help us achieve the goodness in our lives. And what does the empirical evidence show you? And there's a lot of citations for this. Can improve well-being, increases resilience, strengthens social relationships, reduces stress and depression, increases well-being and life satisfaction, enhances the immune system. It even lowers blood pressure, better sleeping, better waking, increases compassion and greatest capacity for positive emotions. And why is it important? It involves noticing the goodness in the world. We have seen that. We have been in the midst of sadness, distress, and we still have to notice goodness in the world, as we've all described and today. It doesn't mean being blind to difficulties that all get from time to time. Indeed, gratitude makes sure that in the midst of things in our life that might serve negative things, we don't lose sight of good. And that is so important to us today. And when we come to the end of a year, almost a year of dealing with this pandemic, I'm now going to ask Derek to put us a little video. We're going to close this with some reflections on gratitude. So can you do that, Derek? I'll stop sharing.
Yes, thank you. Thank you, Dr. Russell. And as we wind up, a short video and a few thoughts on everything that we have discussed this evening and as we move ahead into the new year. I hope it's visible.
Yes,
Yeah, can't hear anything.
When you get grateful for what you have right now, you will soon have more to be grateful for.
Yeah, we can hear it.
It's so true. When you send out those feelings of gratitude, what happens? You become instantaneously happy in this moment. When you're grateful and happy with life as it stands today, so many more things will flow into your life to be happy and grateful for. And the reverse is also true. If you feel like there's nothing to be grateful for, what are you focused on? You're focused on everything you don't want. You're focused on everything you don't have. And what you then think, you will attract into your experience. Exactly. More of what you don't want. Make it your mission to sit down every day and become grateful. Get grateful for the two gifts you have called eyes. Many aren't so lucky. Get grateful for the ears that can hear this music. Get grateful for the person in your life that's made a difference. Get grateful for your tough times because they help develop your strength and spirit. Get grateful for your life. There is so much to be grateful for. There's something to be said about being appreciative and grateful. You know, whether you're thanking God or life, or whether you're looking to a person in your world and just saying thank you, there's something really special about that. I mean, there's something very real about moments where you can just be by yourself and look at your life and just say thank you. You know, thank you for this gift. Thank you for this ride that I'm on. Thank you for this journey. And a lot of people go through their life without experiencing the beauty of these moments. Your life, although perhaps filled with many imperfections, is still an experience. It's an experience that people in their final moments would do anything just to grasp onto for a little while longer. Can you imagine, as you hear this, there are people who are having their final breaths, taking their final breaths on this planet, looking back at their lives and wishing they could have done more. Meanwhile, we have this experience. We're alive, we're breathing air, our hearts are pumping, our brain is doing billions of operations per second just to keep the game going for us. We can't find reasons to be grateful for that. We can't, as human beings, be appreciative for that. There is an entire spectrum of life you are missing out on when you don't take moments to just feel. Just feel. Just create moments of gratitude within yourself, just for the sake of being appreciative, for the sake of being alive. That alone will change your life. That will make you human again. That will disconnect you a little from this game of consumerism and this dog-eat-dog world we've allegedly created. That will disconnect you from the insanity of this society, and it will reconnect you with something greater than yourself. And I don't care what you call it God, call it the universe, call it life or magic. When you begin to be appreciative for life, there is a certain power that will bring you even more reasons to be appreciative. It's one of life's greatest paradoxes. When you're in a state of needing this and needing that, it doesn't matter how much you acquire, you'll never have enough. When you can have the courage to be grateful for what you already have, life will bless you with even more. You know, you can decide in this moment to give it up. Give up the complaining, give up the blaming and the accusing, give up the gossiping and the whining, and instead realize you're on an incredible journey and fall in love with every second of it. That's when you'll truly come to life.
Some days we forget to look around us. Some days we can't see the joy that surrounds us. So caught up inside ourselves, we take when we should give. So for tonight, we pray for what we know can be. And on this day, we hope for what we still can't see. It's up to us to be the change. And even though we all can still do more, there's so much to be thankful for.
As we end today's evening program, while we are just winding up, there's a little bit of a exercise that we can all take part. All our participants can take part in this. You can either do this on the laptop or the device that you are on, or maybe simply on your mobile phone. Just go to Google Chrome or any of your browsers and type in www.menti.com. I repeat, www.menti.com, and it will ask you for a code. You can type in the code and you will get a question which says, what are you grateful for? So I'll be sharing a different screen with you and we'll be getting your answers live. So that gives us a little bit of feedback and a chance to each one of you to express yourself this evening. And while we are doing that, Dr. Russell and the rest can give their ending comments as well. So I'll just share this screen. And we already have a few responses coming in. So you can, the code is still visible again there, www.menti.com, and the code as well. And you can put in multiple entries. So it's not just one word. You can continue to do that. And we'll have the responses coming in. Over to you, Dr. Russell. And we'll see the responses. So I think this is a wonderful way to end on and a wonderful way to be grateful for this year and for everything that it has brought to us. Over to you, Dr. Russell.
Thank you, Derek. Thank you very much for having put all this together. Dr. Mary, thank you for the excellent moderating, but also for the whole year. And all my team, all of you. Gerard Fotwinkle, Professor Fotwinkle, your excellent presentation, which summarized all of what we did and all that we've gone through, what we learned, and all the panelists, Dr. Stacy, Joe, and all the others, Christian, Baroness Finlay, Ilora Finlay, and Vivian, all of you have contributed. Thank you for today. Thank you for the whole year that we've all worked together. And it's indeed delightful, and also with gratitude coming back to all of you and to also to Professor Kami, who gave us this opportunity. We came in without knowing where we were going, and we have reached almost the end of the year, but almost a year. So I want to thank everyone for their contribution, for even the participants. We have a wonderful group of participants from all over the world who keep coming week after week, and for every presentation there with us from, from, as you can see, from all over the world, who appear from India, from Iraq, from Pakistan, from South America, from United States, from Canada, from United Kingdom, Europe, and from Europe, Asia, and indeed India. So thank you all, and we will continue. And I want to take this opportunity to wish all of you a very, very happy and productive 2021. And we are looking forward for solidarity and for all of us to come out of this together as we were all in it together. So I will hand it to Mary. Do you want to say anything before you finish? We finish?
No, I think all of you should see this, look at the screen, and these are the things what everyone has written. What are you grateful for? So you can say health is in the center, family, kids, love of God, compassion, peaceful mind, literacy, medical technology, lovely people in my life, my UNESCO family, research, honesty, that we should be safe, my family, my health, happiness, life. A lot of you have written life. And I think truly we treasure each other's company and the learning that we've had, and the things if we have a will to do certain things, we can do it and we can achieve it in any way. and we'll find a way to also get through this pandemic. So thank you very much to all our panelists, to all our participants. We have a lot of, I did want to bring in a few people at the end. Professor Rizwan Taj, I want from Pakistan, Professor Shailendra Saraf, Dr. Vatsala, and Professor Geeta Lakshmi. They have all been constantly, they're all seniors, and they've been on this webinar series consistently practically every week that we have conducted it. And I really want to thank all of you from the bottom of my heart for contributing to these series and coming out in large numbers and discussing, and for the discussions, and also for the contribution. Of course, my always grateful to Professor Russell and Professor Kami, and of course, Derek. Thank you very much.
Okay, so we've had we end this year's program. We do have plans, and we will be having programs in January. The next one will be on the International Remembrance of the United Nations Remembrance of the Holocaust, which will be 27th, 24th is our webinar, and 27th we'll be having a program, and we'll be sending all these invites to you. So till then,
I think we can give Derek a chance. Derek, you can close it probably.
yes, that's what I was going to tell Derek to come in.
No, I think that was really, really wonderful to see the personal touch at the end. And there are so many things that each one of us are grateful for. And we found a reflection in all those words that were typed on the screen. Like we say, all good things have to come to an end, but there's something better. And definitely 2021 is going to be a better year for all of us. I'm confident that despite all the doubts, if we have weathered a storm and weathered all the worst days that we saw this year, and we are still together, we are still smiling, and we are still united in solidarity, let the worst come on. I think we'll face it with resilience, and we'll still turn out a winner. So on that happy note, good day, greetings of the season to everyone. May you have a wonderful week ahead. And as we move in to the new year, I'm sure that we'll move forward with renewed vigor, renewed energy, and lots of health, good health, happiness to all. Thank you for being such a part of this wonderful team. Thank you for all the kind words. I don't know whether possibly I have to work harder now in 2021 to deserve some of the credit. It's all due to Dr. Russell and all the members of the team, each one of you that are participating here. So let's keep this up. Thank you. Good day. Good night.
Good night.
Thank you, dear Derek. So bye-bye to everyone. Stay
See
safe.
you next
stay
year.
well,
See you
and
next
we will
year.
be seeing you next year. Yes, we will. Thank you all.
Bye.
So happy New Year to everyone till we meet again.
Happy New Year. To
Bye,
all of you.
Ariel. Bye, Vishnu.
Bye-bye,
Professor
Ariel.
Kami, Happy New Year.
Bye-bye, Laura, and Dr. Kami. Happy New Year to you too.
And yeah.
Happy New Year, everyone.
Yeah, thank you. And of course, I think
Happy New Year.
Professor
all of you.
Bellmaker was not able to come in. I think she was on mute. All right. Thank you, Professor Pierre. See you next year.
Thank you so much, Mary.
Thank you, Pierre.
Bye.
Thank you, everyone.
Bye.
Bye, Stacy.
And
Bye,
Happy New
Arun.
Year.
Bye, Arun.
Arun,
Bye,
bye-bye.
Bello. Professor Bello.
Bye-bye.